The body is a very simple instrument. If you misuse it, you have no other place to live.
Why are we having all of these diseases at a higher rate than any other race in America? Why do we have the highest diabetes rate? Why is this? Why do we have the highest high blood pressure rate? Why are we going blind at the highest rate of any other racial group? What's going on here? So you know it's something amok here. Something is going on here. 50% of the black women have fibroid tumors and 1/3 of the couples are infertile. Something is going on here. So I don't know what it takes to have a wake-up call. All I know is that when we came over here from Africa, we were 90% cavity-free. And most of you don't even have all your teeth, which is pitiful. So we have to go back and look at what we were doing before all of this happened.
When people get arthritis, at least this has been my experience, we take analgesic medicines, aspirin, ibuprofen, acetaminophen, those sorts of drugs that tend to suppress the inflammation. Is this the normal treatment that we understand for arthritis?
Yeah, mostly they focus on anti-inflammatories because we're dealing with inflammation. When you hear the word itis, tonsillitis, appendicitis, vaginitis, that's inflammation. So they take anti-inflammatories. Herbally, you would take things like cat's claw or feverfew or a supplement called MSM, methylsulfonine methane, and that would take care of the inflammation without the side effects.
What are the side effects of the traditional, or what we have come to believe is the traditional treatment for arthritis?
Well, you're looking at anti-inflammatories, and that stops the surface from heating up. When you exercise, the muscle should heat up because it increases the circulation. If you take in an anti-inflammatory, it stops things that should heat up from heating up. And that means when you're using your eye muscle or your ears, activity causes the temperature to increase. Now it's going to stop the temperature from increasing, which will retard the whole circulation. And the point of increasing the temperature is to increase the circulation. So when you need more circulation to an area, be it the heart, the eyes, the jaw, you won't get it because you're taking synthetic substance, anti-inflammatory, acetaminophen, ibuprofen, so it's decreasing the body's attempt to increase circulation when it needs to increase circulation all over. That can be the reproductive system as well.
You're saying this, and yet doctors of allopathic medicine, that is MDs, and probably doctors of osteopathy, that is DOs, continue to prescribe or recommend anti-inflammatory medicines for arthritis. Why are they doing that?
That is their training, that's their background. They're not evil people. They're trained differently from naturopaths and homeopaths. And you're going into the field of allopathic medicine, which is known as suppressive therapy. Whatever the symptom is, they try to suppress it. They don't get rid of what causes the symptom. They only suppress the symptom. And that's called allopathic medicine, based on using poisons to cause the body to have a reaction which suppresses the symptom. And naturopathic medicine, coming from the word nature, and pathy meaning disease, this is natural things to prevent disease, which would probably be more herbal, non-invasive, massage, acupuncture, things that don't hurt the body.
What is diabetes?
Diabetes mellitus is a pancreas disease, and it's one of the many diseases that's associated with the pancreas. Also, there's high blood pressure, glaucoma, cataracts, arthritis, infertility, senile dementia, Parkinson's, Alzheimer's. Those are the other diseases caused by a weak pancreas or diseased pancreas. And the one you're talking about is diabetes mellitus, which is commonly associated with synthetic carbohydrates such as white sugar, bleached white flour, white potatoes, things like that, concentrated sweeteners, which can be honey as well. Any concentrated sweetener will stress the pancreas, resulting in diabetes mellitus.
Okay, I heard you say in one of your other speaking lectures that we didn't have diabetes, particularly African Americans, before we came to this country. Could you expound on that a little bit?
Well, we weren't eating the refined carbohydrates. Sugar is one of them. The pancreas is trying to get rid of this, help your body break down this carbohydrate and make sugar out of it. And so we associate that with insulin, which is a hormone made by the pancreas, and glucagon, which is another hormone. One of them brings the sugar rate down, which is insulin, and the other one, glucagon, brings the sugar rate up. So we're constantly causing the pancreas to be stressed by eating a whole lot of carbohydrates, which are mostly processed, and causing the pancreas to bring that sugar level down by squirting out this hormone called insulin. And then the body eventually loses its ability to produce this insulin or recognize the sugar when it's in the blood, and we call it diabetes mellitus.
And you say this can be avoided, right? By just changing your diet a little bit?
Yes.